Hello, everyone, and welcome to the Move, Heal, Thrive webinar, Your Guide to Pain-Free Dentistry. I'm your host, Dr. Nicholas Mercer, and I just wanted to thank you guys for taking time out of your day to learn more about how to improve yourselves and improve, the lives of your employees, your patients, whoever you're doing this for. This is going to really help. And I've been working for several months consolidating this information and organizing it and putting it in an easy to understand way, and a way that people will benefit from. So let's get started. First of all, let's go over what we're going to do. We're going to look at the importance of ergonomics in dentistry. We're going to have an overview of proper ergonomics in the dental workspace. We're going to look at the impact of musculoskeletal disorders, particularly musculoskeletal pain in dental professionals. And then we'll look at some effective movement strategies to help kind of offset some of these weird, improper ergonomic positions that you just have to get into as a dental professional. All right, so who's this guy and what do all those letters mean? So my name's Dr. Nicholas Mercer. I'm a physical therapist, which means I got my doctorate of physical therapy, and I'm also a certified strength and conditioning specialist. But most importantly, I have years of experience treating dentists, dental hygienists, and dental assistants, and I've seen firsthand the suffering that these professionals are going through behind the scenes when dealing with neck pain, back pain, shoulder pain, a lot of different conditions that are kind of unique to the practice of dentistry. So we're going to start out with kind of a quick overview of some anatomical jargon, just so we kind of understand the reason for the tips that we're going to have later on. So in the PT world, we have this saying, it's motion is lotion. It's kind of cheesy, but let's roll with it. So obviously your body has blood. The blood is used to transport nutrients to basically almost all of the tissues of the body. Movement and exercise will increase this blood flow. Now, joints, however, the space between joints does not have blood. And so joints actually get their nutrients through pressure and movement. You can think of the cartilage kind of like a sponge. So when that sponge compresses, it expels a lot of nutrients into the joint space. But if we don't move and we just have that compression, that sponge doesn't fill back up, and then it doesn't squeeze again, and it doesn't give any more nutrients. So it's really pressure and movement, continuously absorbing and pushing those nutrients into that joint space. Ultimately, what this all means is the human body was designed to move. And nowadays, most of the time, it isn't, or it's not moving properly the way that they were designed to. So I want you to think of, kind of keep this big idea in mind for the rest of the presentation, is that movement is optimal. So movement is better than maintaining a position. However, we can't be moving all of the time, right? In order to get our jobs done, we have to be able to sit still and focus. So when it comes to positioning, proper positioning, or one might say proper ergonomic positioning, is better than improper ergonomic positioning. Frequent movement is ideal, but it's not feasible. Again, we have to treat our patients, and that requires us to stay still and focused. Proper positioning is more feasible. It's not ideal because, again, movement is ideal. What we really want to avoid, or at least minimize, is improper positioning. So what some people would call bad posture, bad ergonomics, because this is what leads to pain, discomfort, and stiffness. Now, here's just a few examples of proper versus improper positioning. So a lot of the times it's your lumbar spine is flexed, your hips are twisted, your neck is forward, your spine is side bent. There's a lot of different improper positions. And we look over here at proper positioning, it's more the spine is straight up. We're supporting that spine with some of our core muscles. Feet are flat on the ground, not twisting or anything like that. And you can see this proper positioning is kind of difficult to maintain when you're treating patients, right? That's why this is optimal and it's more ideal, but it's not always feasible. So quick overview of what ergonomics is. So in dentistry, it involves designing and arranging the workspace. This includes dental chairs, tools, lighting, and just kind of the overall workflow of the office to maximize efficiency, safety, comfort, and health of dental professionals. The goals being to make it more efficient, enhance safety, and just improve overall health, preventing musculoskeletal disorders and promoting movement and decrease strain and stress on the tissues of the body. So these are just a few examples of a more ergonomically efficient workspace. You'll see when you're working with a dentist and a dental assistant, there's certain positions that are better and place less strain on the body. And then when the dentist is working alone, you can see that sitting behind the patient allows you to keep everything a little more comfortable for you. You don't have to side bend, twist as much. And then just placement of tools in that bottom right-hand corner so that you're not having to turn your whole body. It's comfortable to reach them, and you don't have to place that extra strain and stress on your body. But especially hygienists, you know that maintaining these positions is not feasible throughout the day. It doesn't allow you to do your best work, especially as hygienists, where you have to really get at all corners and not just look at it, but like really work deep in there. And that's why we're not going for perfection, right? If we stayed perfect, we probably wouldn't be as effective as practitioners. But we do want to optimize positions whenever we can. Patient obviously is always the priority, but you also have to take care of yourself. Adding in movement and corrective exercises throughout your day can help offset some of these necessary but uncomfortable positions and help you stay physically healthy and free from pain. And some of these pictures are just some of the more common exercises I give my patients who are dental professionals, because they seem to help them a lot more. A lot of neck issues, a lot of lower back issues, and wrist and hand issues. And here's some boring numbers, but it's important that we go over them. So there's a 64 to 93% prevalence of musculoskeletal pain among dental professionals. Some studies even say up to 100% prevalence. In dentists, they were shown to have a little bit more back pain and neck pain, and then hygienists had a little more hand and wrist pain. And then there's a little blurb here: 70% incidence of back pain in dentists. Low back pain is the more common one, so almost 50% of cases. Most of the subjects in this study had a mild to moderate level of severity. Only about 10% had severe level of pain, which is not as bad. Most of the dentists treated 1 to 3 patients per day. Only a few dentists exercised during the rest period, even though over half of them took breaks during their working hours. And even though 63% of those dentists were aware of the advantages of assistive tools, not as many actually used assistive devices in their work. And this results in absenteeism, so calling out of work, and presenteeism, which is essentially you're there, but you're not being as productive as you could be. Unfortunately, the impact of these musculoskeletal disorders means that there are more dental professionals considering retiring earlier than ever before. In addition, there's some mental health consequences that come with it too. 16% of dentists experience anxiety, 13% experience depression, which are common signs of burnout. Dental employees reporting presenteeism due to high physical load was 43% in 2014. This indicates that there has to be some workplace interventions that promote health among these dental employees. So what is the solution? Movement, right? Movement is a very, very important component of our day that we take for granted. We need to start adding more bouts of movement when we can to increase blood flow, which is really, I tell my patients, blood is healing juice, right? If you can get blood flow to an area, it will heal faster. It will become healthier. But also into the joints. Remember, we talked about the cartilage needs to compress and decompress and continuously do that in order for the joint to get the nutrients it needs. So adding movement during breaks in between patients, or even like stretches and corrective exercises during team meetings, that's going to be a very important strategy to help maintain the physical health of your employees, your coworkers, and yourself. Obviously, optimizing your workspace, so proper positioning, so that you don't have to get into as many uncomfortable positions throughout the day, is also going to be very, very important. But also just staying mindful of posture and knowing what uncomfortable postures you tend to take, and then utilizing corrective exercises to offset these suboptimal positions so that they don't add up over time and cause pain that keeps you from working, keeps you personally from getting an income, and keeps the clinic from losing money as well. So there's some action steps I want you to take. I want you to take a look at your setup, right? So look at how you organize your space. Does it look more like the pictures we looked at the beginning, or does it look a little messier? Do you notice that you have to get into uncomfortable positions pretty frequently throughout the day? Also think about, do you typically get back pain or neck pain or hand and wrist pain? These can be kind of indicators of where you may be having the most trouble, ergonomically at least. But even shoulder, hip, knee pain, like these can all, they're a lot less common, but they can also play into these ergonomic issues. Do you need better grips for your tools? Do you need to look at how you're holding those tools and make sure that your wrist stays in neutral? How are your table and chair positioned? Is everything positioned in a comfortable space? You can reach it comfortably, or are you finding you have to turn the entire chair to reach something, lean over, come back, and just make these awkward movements or positions in order to access the tools that you need? And then, does your chair need adjusting? Does it need to move up or down? We want the knees and hips to be at about 90 degrees. Are you slouched? Are you having to lean forward more? Are you having to bend those knees, twist the hips in order to get into the right position? Staying mindful of all of this is going to be very, very important. Right? So keeping all of those in mind, and again, we could keep diving into specifics of what we should and should not be doing. But that kind of is outside of the scope of this webinar. That would take a very, very long time to address all of those. But I do want to continue these conversations. And so what I've done is created a free Facebook group called Dental Wellness Revolution. If you look that up on Facebook, you'll be able to find it pretty easily. And then I've actually covered a lot of these subjects, a lot of these concerns in a book called Tooth and Consequence, which is available on Kindle now. And for a limited time, it's available for free. I put it for free for I think 5 days following this webinar live. So go there. If not, I've tried to put it at like the lowest price possible, just because I wanted to get it into the hand. So I believe it's $2.99 after, you know, the free period. But I'll also be making more promotions like that in the future. So and then if you ever want to talk, or think you need more help, or want to look at some other resources that may help you in your clinic, please feel free to call or text me at that number, and then send me emails. I'm happy to talk with you about what we can do to help you, your staff, your coworkers have a more successful career, stay out of pain, and just have a healthier and happier life, because this is essentially an epidemic in the dental profession. And so I want to make sure that we do everything we can to keep you guys healthy and out of pain. So again, thank you for joining me today. This has been something I've been working on for a while, and I really hope it helps a lot of people. Yeah, so go join our Facebook group. Let's continue this conversation. Ask me some questions, and let's talk about this and get this figured out, okay? And then lastly, just have some sources for some of the studies that I use for those numbers, all right? So thank you guys again. Looking forward to talking with you guys more and working with you to live a happier, healthier, pain-free life.